The following is brought to you by the Committee to Protect Healthcare. In the emergency department, we see real-time consequences of people not having access to health care. Expansion of Medicaid in Wisconsin would mean less cases to the emergency department. It would prevent closures of hospitals in our communities, and most importantly, save lives. The majority of states in the country have expanded Medicaid with bipartisan support. Yet, legislators in Wisconsin are blocking expansion of Medicaid. They're blocking the opportunity for our patients to have a healthier life.
Tell your legislator to save lives and pass Medicaid expansion.
A Georgia woman has been identified as one of the first deaths related to lack of abortion care access.
Amber Thurman died waiting 18 hours for a D&C, the surgical procedure sometimes used in abortions. The report finding her death likely could have been prevented.
It was jarring, shocking, and disheartening that my Georgia doctors could not provide me with the standard of care.
Georgia women and medical providers testified before Senator John Ossoff's Human Rights Subcommittee in opposition to Georgia's law banning abortions after a fetal heartbeat is detected. Medical experts say that's typically around 6 weeks. ProPublica released a report on internal documents from the Georgia Committee reviewing pregnancy-related deaths. The report indicated the committee, run by the State Department of Health, determined the death of 28-year-old Amber Thurman was likely preventable if she'd had access to abortion care in Georgia.
In August, when Amanda was 18 weeks pregnant, her water broke, losing the amniotic fluid her baby needed to survive. Her doctor told her,
"You're 100% for sure going to lose your baby."
The nightmare got worse. Her doctor said because of anti-abortion laws in Texas, they couldn't terminate the pregnancy, even though Amanda was at high risk for a life-threatening infection. Texas law allows for abortion if the mother has a life-threatening physical condition that places her at risk of death or substantial impairment. But Texas lawmakers haven't spelled out what that means.
I was shaking, my teeth chattering, trying to tell Josh I didn't feel good.
She went downhill very fast.
The bacterial infection could have been prevented if she'd been provided an abortion. When her temperature hit 103 degrees, doctors terminated the pregnancy. But Amanda was still sick. Her blood pressure crashed and she needed a blood transfusion.
They said, "We're moving you to the ICU."
Central issue physicians must now navigate is the exception to save the life of the mother.
The law as written in the state of Wisconsin is still very gray.
It's intrinsically vague, which then causes physicians to potentially second guess, like, is this risky enough? Because everyone who practices medicine knows that it can be very gray for a while and then become very black and white. The longer you wait to intervene, the worse the outcomes are in general.
There was a time when I was in Minnesota where someone presented in an emergency in an ambulance. She was bleeding. She had to go to the operating room right away, and I had to perform an abortion. And I couldn't help but to think to myself, if this was happening to me in Wisconsin, I would be terrified about what the next steps would be, about what the implications for my future, my career would be.
I will continue to fight for these patients because they need a voice. Everybody needs a voice in this fight. And a lot of the voices that are at the table right now don't see these patients and they don't have any medical background, but they're making these decisions. Welcome to Pulse Check Wisconsin. Good morning, good evening, good afternoon. This is Dr. Ford with Pulse Check Wisconsin. I want to thank you for listening to now our second part of our series, The Politics of Public Health. We have a really good episode. If you didn't catch the first episode of our series, I recommend that you go back, I was able to speak with Representative Deb Andraka as well as Dr. Megan Schultz, who's a pediatric ER doctor, and we discussed the importance of gun legislation in the state of Wisconsin. So if you didn't catch that, feel free to go back and listen to all the amazing things that they had to offer and examples that they had to give of how our current gun laws as they stand affect Wisconsinites and ways that we can improve the safety of our communities and the safety for our children. In this episode, what we will be doing is we'll be talking to Diane Welch, who is the lead legal counsel for the current case that we have in the Wisconsin Supreme Court regarding the statute, which is on the books at this time, limiting reproductive freedoms in the state of Wisconsin. Diane Welch is a partner with the firm Pines Bach, and she has had over 2 decades of experience advocating for citizens of the state of Wisconsin. She served on the board of directors for Wisconsin Democracy Campaign, Domestic Abuse Intervention Services, as well as Wisconsin Women in Government. And she's currently a member of the Dean's Advisory Board for the University of Wisconsin Whitewater College of Letters and Sciences. So Diane is the legal counsel for myself and 2 other of my colleagues in the roles that we have taken in this case as being interveners. And what we provide as interveners is expert opinion on how restrictions in reproductive freedoms in the state of Wisconsin affects our patients. And we give that context from the standing of our professional roles. So myself, from the standpoint of an emergency medicine physician, and my other 2 colleagues from the standpoint of being obstetricians and gynecologists in the state of Wisconsin. So in this episode, Diane updates us a little bit on where we stand currently in the state of Wisconsin with regards to reproductive freedoms and where she perceives this case to go in the future. So with that being said, we'll go ahead and get started with our interview with Diane Welch. For our listeners, I gave a bit of an intro as to who you are and the amazing things that you're doing throughout the state. But if you can, could you just give us a little bit of your background?
Sure. I grew up in rural southeastern Wisconsin and have worked in higher ed for about 10 years before deciding to go to law school. One of my motivations for law school was I decided there weren't enough women in the legal profession, either making the laws or interpreting and prosecuting or applying the laws or judging the laws. And so I really was focused in the policy role that women lawyers could make. So I went to law school in DC, and my first job after law school was at the Wisconsin Department of Justice, where I worked for about 5 years. And then I moved into the Department of Health and Family Services and worked there for about 8 years. And that's where I really became focused on reproductive health care and access for women, among many, many other issues. But, looking at some of the issues about like access to reproductive health care, maternal and child health, infant mortality rates, maternal morbidity rates in Wisconsin, and numerous other aspects of health and family services in Wisconsin. Then I moved into private practice several years ago, and where I have been since. And since that time, I've had the great fortune of representing a lot of the family planning clinics around the state and some physicians and nurses and others who do this important work.
Yeah, and I commend you for doing all that. It seems like you have a really good track record at advocating for a lot of the women around the state of Wisconsin. I see that you're on the board of, the Domestic Abuse Intervention Services, Wisconsin Women in Government, et cetera. And just to kind of tie all that in, all that advocacy in, what drew you to, or what motivated you to become involved in what we'll discuss today, which is the reproductive rights litigation?
So I think I've had like feminist beliefs going back to girlhood, like girls should have the same opportunities as boys. I don't know if it's having strong, aunts in my life that were good role models or having five sisters or what, but the idea that girls should be more limited in their opportunities than boys like never sat right with me. As I got older, seeing like the impact of like economic disadvantages for women, and also domestic abuse and that impact that violence against women had, it really kind of framed my thinking and was one of the motivators for going to law school. As it relates to access to reproductive health care, I think women's opportunities in so many ways are really shaped by their ability to decide whether or when to have children and the timing and spacing of their pregnancies. And in every way, like this can, their ability to maintain an interesting, fulfilling career, and build up generational wealth, depends on, how many kids are they taking care of. Their ability to perhaps leave an abusive relationship may be tied to, their pregnancy status or how many kids they would need to support without a partner. Their ability to fulfill a passion in the arts, whether it's acting or, creative arts, can depend on, their pregnancy status and how many kids they're caring for. So in so many ways, women's ability to live full and active lives, and make choices they want to make are also tied to their ability to make choices about how many kids to have and when to have those kids or whether to have those kids. And I use the term women, and I know that across the gender spectrum, there may be people who don't identify as women who may be pregnant or have children, and just to be a little less complicated because I'm going to use the term women for people with differences.
Yeah. And so, just to kind of bring that back to Wisconsin, like you were saying, it limits women through all spectrums of life, all socioeconomic walks of life as well, when you don't have that ability to make your own reproductive decisions. And in the beginning, we did a couple of news clips from different instances, more so from the medical spectrum, what complications of pregnancy may arise, et cetera, et cetera. But just to kind of go back in the state of Wisconsin, so in June of 2022, as we all know, overturned Roe v. Wade. How did that affect folks in Wisconsin? What did that mean for Wisconsin, just in kind of taking us back?
Mm-hmm. Fortunately, we had some conversations prior to that because as soon as the U.S. Supreme Court accepted the Dobbs decision, those of us who were working in this space were aware that a change could be coming. And so there were lots of conversations with OBGYNs, attorneys working with health systems, and abortion providers around the state to talk about what might this mean and what would happen if Roe was reversed. But what happened was in Wisconsin was significant because Wisconsin had this very old law on the book that hasn't been enforced for half a century. And some conservative legal scholars put out a white paper saying that like this old law would kind of come back into force and be enforceable against physicians who were providing abortion care. And we've never had a situation in Wisconsin or across the country where a well-recognized right was established by the U.S. Supreme Court. The state legislature, for the past 50 years has been making laws about abortion, and then but they never took the old law off the book, because it had been, overruled first by a federal district court, and then, also negated by Roe versus Wade. And so we were really felt like a state of limbo, and the uncertainty was great as we approached, we were in an election year. We had candidates for attorney general. We had district attorneys saying, of course, the old ban could be enforced. And we had others saying, like, no, that old ban doesn't spring back to life. It's not like a zombie law that comes back to life and eats up all the other abortion laws that our modern day legislature has passed in the last few decades. But there was uncertainty. And with the old ban, because it was a felony, there was a 6-year statute of limitations. So anyone who's working in the healthcare care space, abortion space, emergency department space where a woman might come in needing abortion care, and was faced with like, okay, I know my current DA says he doesn't believe it's enforced and won't enforce it, but what will a future DA do? Or will an attorney general, that has a different belief than the current attorney general come in and try to enforce this against me 5 years from now?
Mm-hmm.
So we went from settled, established law that physicians working in healthcare, providing care to pregnant women, knew what the law was and when they could provide care and treatment and what they could do, to like a lot of uncertainty. And it was very hard for healthcare practitioners and the lawyers advising them.
Oh yeah, and for all the listeners, to be clear, to put it into context from a medical perspective, this is before we knew that bacteria and viruses cause sickness, right? Like this is before we knew the effects of a medication like Tylenol, right? And so what we did was we reverted back to this law, and it created, as Diane was saying, this uncertainty not only for myself practicing in the emergency department, but for providers in the OB-GYN realm, for providers who worked in rural locations. They were on the phones with their lawyers when they should have been on the phone with their consultants when they have patients that are presenting with what we call ruptured ectopic pregnancies, non-survivable pregnancies to term for the fetus, but could be devastating, could be deadly for the mothers. And so, these are things that all of us in the know, as Diane said, they were gearing up from the legal standpoint. We were gearing up from the medical standpoint when we saw the ball rolling, just to try to get providers to know, hey, you're covered by EMTALA, and you have that coverage from a medical and from a legal standpoint to do no harm in the cases of these patients.
Right. And like if you're working in an emergency department in a hospital, then EMTALA applies, which is the Emergency Medical Treatment Act, which applies for any hospital that accepts Medicare funds, that makes sure that the hospital provides like stabilizing care and treatment for any patient, regardless of their means to pay. It doesn't apply in physician offices, though. So somebody working in a clinic, serving high-risk pregnant patients or otherwise wouldn't have the same protection that was, the Biden administration said applied, related to EMTALA. We tried to very quickly have conversations, saying like an ectopic pregnancy is never going to be a viable pregnancy and will always pose some risk to the pregnant patient. However, that didn't mean there weren't health systems or hospitals that were taking more conservative approaches. And conservative for multiple ways. We have a high number of Catholic-run health systems in Wisconsin, but we also have health systems that are more risk adverse, and just wanted to like not have any question about what the conduct might be. So, so it was troubling to see how health systems, physicians, other healthcare providers too, had to weigh the interests of their own operations and their physicians versus their patients, and weighing out what was best for each. And it wasn't always the same. So we saw, heard reports of patients being turned away to go to Minnesota or Illinois or Michigan to get the care they otherwise would have been able to get in Wisconsin.
Yeah. And I gave a couple examples, too, of patients that I saw personally that did just that, Diane, right? That went to Illinois and got incomplete care because they didn't have the financial means to go back or even the physical means to go back. So in some cases, some of these patients are adolescents, right? And, had to go emergently to the OR. Unfortunately, I was practicing in a inner city location that has a lot of resources, has providers on staff, and we're able to get them to those means to get that definitive treatment. But I've worked in rural locations where I was the OB for 40 miles, right? Like that was the situation, just being the emergency doctor in the hospital. And so, like you said, it could cause that uncertainty, and that law is specifically gray, as we've seen in other states as well, that we don't know what that means. We don't know what the life of the mother means, or, what that means in those cases.
Chris, I'm glad you mentioned that the grayness of the law is extra frustrating. One that, an abortion can only be provided to save the life of the pregnant patient. It's like, how imminent would that need to be before that would be triggered? And then there's language that said that determination can be made by the treating physician or two other physicians. Well, some attorneys were interpreting that to mean like three different physicians had to all agree on it. And they were requiring physicians to like get a second or a third physician to sign off on it. And, in rural areas, there's not, multiple OBGYNs on duty all the time or, physicians and who are willing to like quickly sign off on a decision that might have criminal implications down the road if it's misinterpreted or if somebody second guessing it. But even that language is confusing. And, from our perspective in our case, as that's one of the due process concerns we make about the old law, that that doesn't give physicians notice about what's required.
Absolutely.
Like knowing what it means to be required to save the life, of the patient. The other, it's all of them are required to be performed at a maternity hospital. Wisconsin doesn't even have maternity hospitals anymore. Like there are hospitals who have maternity wards, but that whole category of licensure has went away. There's like separate requirements or restrictions for quickened children versus not yet quick child, which has no medical definition in this day and age. And the Dobbs decision, even the majority opinion written by Justice Alito, says that that is a term means no one has a common understanding of that term, right?
No.
Generally, like when the fetus is felt to be moving. Right?
Exactly. Yeah. And that was, as you said, that was one of the points that we came to, is just the fact that there is no standardization of that, right? Like that interpretation of it was put into law before there were ultrasounds in order to see or to hear, a fetus's heart rate. And so it's just completely arbitrary and dangerous, to be honest with you, at this state of the game.
The other thing that made it extra confusing is what, decades ago, our state Supreme Court had considered what the statute meant in light of the more modern abortion laws and said it was a feticide statute. The case, State versus Black, arose in the context of prosecuting a guy who beat up his pregnant spouse with the intention of killing the infant a few days before her due date. And charges were brought by the district attorney, back in the 90s, under the old abortion ban. What was that? Thought of Hesse, but it has it was intentionally killing, an unborn child, and so they brought it under that law. And our state Supreme Court looked at that case and said, yeah, so now, kind of in light of the other law, this is a feticide law. It prohibits the intentional killing, in this manner. It doesn't apply to medical abortions because we don't have laws that do that. So that made it more confusing. And that was, the basis for, and jumping ahead here, for the Dane County Circuit Court saying, yeah, this is no longer an abortion law. The old, used to be our old ban is now a feticide law.
Yeah, and it's totally fine to jump ahead. So where are we at today in terms of, because again, 2022, we go back, that's the law of the land. We're all kind of working under this cloud of uncertainty. Where are we at now, and kind of what role did you and your firm play in that?
Right. So very shortly after the Dobbs decision was decided, Attorney General Call brought a lawsuit seeking a declaratory judgment to what does this law mean? Is it still in effect? How does it relate now that we have all these other laws? We intervened on behalf of 3 physicians, including yourself, as persons who are most directly impacted by the confusion and face potential prosecution under the old ban, if there was a district attorney who interpreted it differently than we interpreted it. So we intervened, and we had oral argument in the Circuit Court of Dane County, and the Circuit Court ruled in favor of the physicians who intervened. And intervene means to like join the lawsuit. Like, we're not the ones who brought it the first time, but we say we have an interest that's potentially could be injured, so we should be here too, and we should be a party. So by intervening, we were full parties to the case, and we prevailed. The judge said physicians are at risk of being injured by this application of the old law, and under State versus Black, the case I talked about a few minutes ago, that is no longer the standard for medical abortions. We have all these other laws that regulate medical abortions, and that's what applies to them. So she issued a declaratory judgment saying it's no longer in effect. So that was good news, and I think most health systems and providers, saw that as an opportunity to change, and the abortion clinics in the state reopened, and most health systems took off some of the restraints that they may have placed on their healthcare providers while there was a question. District Attorney Armansky appealed the case, and he asked that the Supreme Court grant bypass, which means instead of having this argument before the Court of Appeals and then seeing what the Court of Appeals does, and then the potential to have it reviewed in the Supreme Court, he asked the Supreme Court just to shortcut the Court of Appeals and hear it directly because of the important questions that were raised. The physician interveners agreed. We asked the Supreme Court to take it as well, as did the Department of Justice. Yeah. And so that case is set for oral argument on November 11th. So the Monday after the election, we'll have argument at the Wisconsin Supreme Court. We'll be arguing to uphold the Circuit Court decision, which says this old man is not in effect. Right? As I like to say, it's not a zombie law that comes back and takes over all the other modern day abortion statutes.
Yeah. So after these arguments, is there a potential that we can revert back, like you said, or what do you foresee to come out of this?
There's the potential, but I'm very optimistic.
Okay.
Elections matter. And there was a judicial election last April, and the court switched from a conservative majority to a progressive majority. And we don't know how any of the four progressives will vote in this case, but I remain optimistic. But even as it comes to the conservative justices, the notion that a law that was passed and replaced with many more modern laws, to me seems very undemocratic. When you look back, when the law was originally passed, women couldn't even vote. There were no women legislators. Even when it was updated and moved into a different section in 1955, women had been voting for a short time, and there was very little representation in the legislature. To say that our forefathers' view of what should happen versus all the modern legislatures that you and I had the opportunity to vote for in the last 20 years, that our modern legislature has to take a back seat to very old former legislatures makes no sense to me from a democracy standpoint.
Right.
Yeah.
Right.
Yeah. So I think to say that this old law replaces all the modern laws seems like a bridge too far.
Mm-hmm. Mm-hmm. Yeah.
And so I'm very optimistic. We also, related to this topic, there's another case pending in our state Supreme Court, which deals with whether that old statute, if it was a ban, would violate our state constitution. So under that litigation, it kind of takes it another step further. Wouldn't applying that law violate people's right to life, liberty, and the pursuit of happiness?
Mm-hmm.
And when I talk about this, what we talked about toward the beginning, deciding how many kids do I want to have? What do I want to have? What else do I want to do? Do I have health risks that might be implicated by a pregnancy? All those questions arise in the context of our state constitution, which includes language that doesn't exist in the federal constitution. And one thing that was made clear in Dobbs is now abortion is an issue to be left up to the states. So we don't just look at state statutes, we have to look at our state constitution as well, as like a separate basis for rights. And that section of our state constitution is recognizing inherent rights, like not rights that the government gave us, but rights that we are born with and the government needs to recognize. And in North Dakota, the state courts found that their state constitution provided rights similar to what we're seeking in the second case. So we anticipate that our state Supreme Court will probably decide Hall versus Hermansky, the case you're involved in, and also Planned Parenthood versus Hermansky, which raises the constitutional question by the end of this term, which is by early July. So we can have this firmly, whether it's statutory interpretation or constitutional interpretation or both.
Yeah. And you bring up a good point there, too, especially how the Dobbs decision took it directly to the states. I was recently listening to an excerpt, I believe it was through Texas Public Radio, where they had a really good piece on fetal personhood and how stricter state statutes will lead to issues not only for emergent situations like ectopic pregnancies, but also potentially for IVF patients that are seeking to make their families complete. And in Wisconsin, we're starting to hear some of this language as well. Folks' interpretation, especially now this is an election year, you have more conservative candidates, even in my own Senate district, that are bringing this point up of fetal personhood. What is that? And is that something that we're considering as well in some of these cases?
It's not directly part of this case, but it is part of the landscape because we have state Republican legislators who individually believe that there should be fetal personhood should be recognized. Also, that that personhood begins at conception, and who would ban certain forms of contraception. So we certainly have some legislators who would remove some contraceptions and make them illegal, would remove funding, public funding for certain forms of contraception or contraception in general. So yes, there are certain legislators who would prioritize the life of, an zygote, embryo, fetus ahead of a patient or a woman.
Yeah. Yeah. And that's the part that's concerning, right? Especially in the setting of, again, national elections are coming. You're hearing more and more rhetoric about bringing the things back to the states and quote unquote letting the states make their own decisions. But as we discussed on this podcast before, how much goes into the states making that decision? Is it really you making that decision, or is it your legislator? Is it from a gerrymander like map that your legislator has chosen? Right? There's so many things that go into it, and even looking at it from a medical perspective. Again, in the cases of these are non-viable pregnancies, but can be extremely dangerous for women, especially if you get internal bleeding, et cetera, or become septic. What does that mean to those providers? What does that mean to those women who are coming in? Does that mean that we wait for them to get to a certain level of, a fever, a certain level of instability? Do we wait for them to lose a limb, for instance, which can happen in the cases of sepsis? That's not considered in some people's ideology of, is this actually the life of the mother?
No, and that brings up an important point, getting back to your earlier point. And in some of those cases, waiting too long can impact the patient's future fertility. So having, right? So, something could happen, this could be a very wanted, desired pregnancy, but because of complications, it goes wrong, and medical intervention is necessary to save, preserve her health, but also her fertility, should she want to have a child in the future. And the laws that are purportedly, protecting, promoting birth and live birth can get in the way. The fetal type statutes or abortion laws can get in the way of preserving her fertility for future healthy births. It also, as you said, has implications for IVF, where again, couples who very much want to have children resort to IVF, but if every embryo is a life that can never be destroyed, raises significant complications because, there are more eggs that are fertilized and would ever be planned to, fully develop and be born, right?
Yeah, absolutely. I've had many colleagues that have gone the route of IVF, and it took years for them to conceive and have an infant in their arms, right? And so that is something that we need to continue to keep an eye on, and especially considering the lack of science in some of these cases. Now, I don't want to talk down on any individual representatives in particular, but I've sat across from a number of legislators and a number of representatives and have been shocked, to be honest with you, about their understanding of science. And I could only imagine what they get in science when they were coming up, right? Because it's just like what let's just start from scratch. All right, let's just start over again. But it is that lack of understanding, and it's the caliber of that understanding that's sitting at the table that not only are making these decisions, but making the decisions for their constituents that may or may not have voted for them, that concerns us all, right? Like in the instances of some of these fertilized ovum in the setting of IVF, some of them have congenital abnormalities. Some of them have karyotype abnormalities that will never be viable, right? And so in those cases, there is a lack of scientific thinking. There is a lack of critical thinking to this point, and just kind of, this is what it's going to be. That's what we're all concerned about.
Right. And there's both a lack of scientific thinking, and I don't think it's necessarily related to poor education versus like intentional disregard for science. But there's also just views on the roles of women in society. And I have heard a sitting legislator say that our workforce shortage issues are because women aren't having enough babies. And I just find that very offensive that like this view that like we're the problem because we're not all producing more children. And if we did want to provide incentives for couples, women to have bigger families, there's ways to do that, like having, universal health care, having universal affordable child care, having affordable education, K through college, all of these things, that considerations that people have when deciding how many children to have. Cost is a big driver. Having parental leave, paid parental leave would be, one reason some people might not have more children. So there's ways of providing incentives for couples to have more children if we really think we need more future workers. But the idea that this is just lands on women's shoulders, and if we have anti-abortion policies that will build up our workforce, and I think it's not the right way to do it. I just think we're not better off adding unwanted children into a society.
Exactly.
Like if couples are affirmatively believe they cannot, raise, support, nourish a child, I think that is an important decision to make, hopefully in planning contraception, but if there's a failure in planning or failure of contraception, to make a decision versus just taking away the option for contraception.
Absolutely.
Or abortion, and then meaning like that's how we get a bigger workforce.
Exactly, and that's key to the point too, because as you said before, a lot of times the contraception is considered, to be included in the realm of abortion, right? So oral contraceptive, Plan B, all these things that are definitively not that, are interpreted by people who, again, are either ignorant of the science or purposefully avoiding, any truth to the matter, in saying that we're going to lump all these things together. All these things are abortion, and you can't do any of them.
Right. So if you're, view fertilization versus implantation has, one's conception, one's life, one's, other things, and applying your own moral view versus the scientific view, that makes it a lot harder.
Absolutely.
For making good decisions about what contraception should be available and what options should be available.
One of the things that we're seeing now are the beginnings of some of the consequences to having this reversion, more strict laws in the books on, in some states such as Texas and Georgia. Unfortunately, we saw at least 2 women that had fatal results from this that we know of, right? That we are publishing in the mainstream media, so to speak. What are some of the most significant legal and social impact that you have observed just in your own practice since this decision?
Right. I think first is the confusion is was the greatest. And then the women who could travel out of state to get the care they needed, they had to, instead of getting care by their trusted providers close to home, then had to travel out of state. And what I heard from women is, their physician saying, I wish I could do this, but my lawyers are telling me I can't, or my hospital is telling me I can't, or I'm told I can't do this. So, already in distress about their status, that they have, that their pregnancy has failed, and now they have to go out of state to get care. And then some being denied follow-up care because their healthcare provider was just even concerned to do the follow-up care that was required, as sometimes even for medically necessary abortion, there can be complications or follow-up care that's needed. But some physicians or healthcare systems not even wanting to go there, and that part is very frustrating. In some states, there's been the concern about where it would be a miscarriage, and then women are investigated as if they did self-managed abortion when it was, a spontaneous abortion, a miscarriage, and which is extra troubling to me, criminalizing something, a traumatic event.
Yeah.
Many women which will resorted to online pharmacy for receptive pills, which so that removed, since I've been able to come here locally, meet with the physician, get the follow-up care they needed, they were left to self-manage it, even if they would have preferred to do this with the care of a healthcare provider locally.
And to that point, to this day, even though we have now swung out of this, at least hopefully permanently, but at least temporarily, I have recently seen women in the emergency department who have done just that, Diane, who have gotten, quote unquote, abortion medication online because they're under the assumption still that we are still under this restriction to provide abortion care in the state of Wisconsin. So, like we said, we have yet to see the effects down the line of just 2 years plus, right? Because that information has not gotten out to everyone as of yet, and people are still thinking, if I go to the emergency department, which is what we saw at the very beginning of this, if I go to the ER, they'll find out, right? If I go to the ER, there'll be police waiting there for me because, again, as we're nearing national elections, this is what folks are hearing. This is what people are seeing online, social media, et cetera, and it's building this very unsafe environment for our patients to live in and for our communities to be under.
And because this is state by state, but the dialogue and social media posts and everything are national, there's just more confusion because if you read a story about a woman in, Ohio being prosecuted or something happening in Texas, people in Wisconsin don't know what that means, for them, and one thing that we said repeatedly, under Wisconsin statute, even, the worst version of the old law, women themselves can't be prosecuted for obtaining an abortion or self-managing an abortion. That is specifically excluded from that statute. So the patients you see who maybe have tried to self-manage an abortion, that's not illegal in Wisconsin, even under the worst interpretation of the old ban.
Yeah.
But again, how to get that message out when really what we need to do is modernize our abortion laws overall and make them clear for all patients to know, and not just patients, for people who are planning their futures and So hopefully we'll get a good decision in this case. Hopefully we'll get a, good legislature that could look at, improving our contraception and abortion laws versus taking them back more than a century.
Yeah, yeah. And, I know in your field, you likely get a lot of opposition and a lot of counter arguments that are presented to you. I know I do, just by being involved in the case. How do you address, some of the opposition, some of the counter arguments presented by people who are very supportive of restrictive reproductive laws in the state of Wisconsin?
I respect that friends, family may have different religious views or moral views on abortion. And I just say that I believe that it's a very individual decision and, a very personal decision. And I don't think I should impose my religious moral views on others and vice versa. And that if a person believes they can't go through with the pregnancy, whether it's because of health conditions, at risk to their own health or life, or because they're just, not equipped to bring a child into the world, that is just a decision I prefer be made at an individual by individual level. I think it's actually uncaring to demand that others bring an unwanted child into the world.
Mm-hmm.
And, I don't know that that's the best thing for that potential child.
Absolutely. What do you see as the future now? Because I know that you said this case is split into two cases at this point in time. What do you see as the future of reproductive right litigation in Wisconsin, and also just kind of on the grand stage, like in the United States? Where do you see this going?
So Wisconsin, a lot will depend on how the court addresses, the two pending cases, the statutory case and the constitutional case. If Wisconsin follows other states in recognizing the state constitutional right, then that has implications about what kind of restrictions could be placed or could not be placed on abortion or contraception or IVF or other forms of really any issue that deals with bodily autonomy going forward, right? So if we, if our right to life, liberty, pursuit of happiness really means something for each of us, I think that has brought implications that we might see other cases deal with in the future. I mean, if our court says no, it doesn't, UFET doesn't mean that, and it may have negative consequences for protecting some very rights that we think should be personal decisions that couples or individuals would make.
Yeah. And along those lines, what do you think that we can do, both in your realm and in my realm, to improve the public understanding and that support for reproductive rights? Because as we said before, this is not only along the medical track. This is not only, that life, liberty, pursuit of happiness, the bodily autonomy. There's a lot of things that go into this, including socioeconomics. There's a religious aspect. There's cultural aspects that go into it too. What can we do to improve that public understanding of the need to have these reproductive rights intact?
I think we need to keep talking about it, not closet this issue. When you think about like maternal life and like who's at greater risk of dying from pregnancy or birth and infant mortality rates and other things where there are so many factors that go into that, and to just pretend that everyone who gets pregnant will be just fine, and that,
that doesn't work that way.
That way. Yeah. I think also taking abortion out of just that it's only this elective, decision to make where, really abortions are provided, all around the state, not just at abortion clinics, right? Because it had, in the emergency room, when someone presents with a medical condition for which an abortion is the right medical decision. And then there's spontaneous abortion, things that just happen on their own. So to take it out of this idea that it's only this procedure that's only done at abortion clinics and should be suspect at all times, I think we need to just keep talking about the realities of and not make it a closeted issue that we don't talk about and the real implications. I think talking about the overlap of, again, some of the same organizations that are pushing the most restrictive abortion policy also push limits to contraception and who can access contraception. And just early in my career, I heard this story about like how in Europe, when they're talking to teens, like they recognize that teens might be experimenting with sex. So instead of just saying like, they don't say like, don't do it, like just say no. They say, don't get pregnant. And here's how you don't get pregnant. And in many other countries, there's a much lower teen pregnancy rate than in the United States because the message isn't an unrealistic, just say no. It's a more realistic, if you're going to do it, this is how you prevent an unintended pregnancy, and this is our expectation. So I think, again, some of the same people who don't want, who want to limit the legality of abortion and limit access to contraception also want to limit discussions of sex education or access to reproductive health care for minors.
Which runs contrary to their to the goal ultimately, right?
Exactly. So I think we need a more holistic and realistic approach, overall to talking about, family planning, reproductive choices, sexuality, and should parents be involved in most discussion? Absolutely, but if they're not, there still is a role for others to be involved.
Well, Diane, thank you so much. Just to close everything out here, is there anything else you would like our listeners to know about the fight for reproductive rights in Wisconsin? And how can listeners follow you or get in touch with you if they want to get more information or support any of your efforts?
Great questions. I think the most important thing that listeners can do is vote. We have important elections coming up in November, and then in April, there's a state Supreme Court election, and a lot of folks don't vote in the state Supreme Court elections in April. It's very important to know the candidates and know their positions on issues related to reproductive health and everything else that might be important to you. And there's no way to follow me very well. I'm not presence on social media. I'm just kind of quietly working in the background.
Yeah, we appreciate it. Keep working.
But I'm happy to come and talk to you again, Chris, whenever you want. And I think when we have a decision, which might not be till summer, I think there will be news of that decision or those decisions. But again, please vote in November and again in April. And again, knowing who supports the rights that you hold to be important.
Absolutely. And that's the intention of this, just to give folks that idea of, the background, right? These are the facts. This is coming straight from the source. As Diane said, she's in the trenches, so she may not be on social media posting, but she's fighting this fight for women throughout the state of Wisconsin to make our lives safer, to make families safer, our community safer as well. So, Diane, I appreciate you so much for coming out and making the time, and thank you for all your efforts. And we are looking forward to hearing more from you. We will definitely reach out to tie a bow on this and figure out where we're at in the summer.
Thank you, Chris, and thank you for being part of the litigation. That's really important work that you're doing, in addition to, being at work every day with your position code on.
Awesome. Well, thank you so much. In 2023, the American College of Emergency Physicians, or ACEP, issued several statements on reproductive freedoms. For our listeners, the American College of Emergency Physicians is the governing body, one of the main governing bodies for emergency medicine doctors throughout the country. And in their policy statements, they supported equitable access to reproductive health care, including abortion, in emergency departments throughout the country. And they supported the idea that abortion is a medical procedure that should be a shared decision between a patient and their physician. As we also discussed in this interview, we support EMTALA as well, which is the Emergency Medical Treatment and Active Labor Act. And this emphasizes the right of emergency physicians to provide care to pregnant patients without the fear of legal consequences. As we discuss, the entire goal of some of the advocacy that we've done over the years since the overturn of Roe v. Wade was to provide physicians with the information that they need to have on hand to make the decisions that they train their entire lives to do when it comes to patients in active labor, patients who are in extremis due to complications of pregnancy. We want physicians to be on the phones with their consultants and not on the phones with their lawyers when considering next steps to take, because seconds and minutes count in these situations. The way that the law is written, as it is in the state of Wisconsin, let's say if this case in the Supreme Court is overturned, we go back to a law from the 1800s. And in the 1800s, we did not know the extent of the things that we know now in medicine. We did not know what a survivable pregnancy was. There's language which is discussing quickening, as Diane referenced, and that is ultimately the first time that a mother can feel the baby in the womb. And so that was the measurement of stating that a pregnancy is viable in those days. We have become more sophisticated since that time in terms of medical capabilities. We know what a viable pregnancy is and what a viable pregnancy is not. And so there's a lot more nuance that we have now as compared to the law when it was written in the 1800s. And whereas all of us in the medical field and most of us who are reasonable on the subject know, we are currently in a better place in terms of what we can do and the lives that we can save, where we are in 2024 versus where we were in the 1800s. However, there are some members of the legislature that wish to revert back to a law that is archaic, to a law that is dangerous, and to a law that, if it is made the rule of the land, yet again, will cause harm. There will be deaths here in the state of Wisconsin, just as there were in Georgia, just as there are around the country that we may not even know about as of yet, because a lot of people do not present to the emergency department, again, for fear that they will face repercussions based on doing self-managed abortions or seeking abortion care in other states where it is legal. So this is something that is going to affect all of our population. This is not something that's going to affect one group or the other. It will affect everyone, contrary to some opinions that you may hear on talk radio, that you may see on social media, will affect those who are traditionally most affected by social determinants of health. I can tell you anecdotally, as an ER doctor, I have seen women who have been in very dangerous positions since the overturn of Roe v. Wade in my emergency departments because they were fearful of what would happen if they sought care here in the state of Wisconsin. We all need to advocate for our patients, and we all need to have the facts at hand in order to help make these decisions. That is why we went to medical school, right? That is why we did all this extensive training to have the science at our hands, to be facile at appraising the information that we have in front of us, to do no harm. We want to make sure that we are able to practice at the best of our abilities and with the full extent of all the skills that we have acquired over the years in order to make our hospitals safer for our patients and to make our community safer as well. A lot to think about in these episodes. I want to thank you all for taking the time to listen to part 2. Please join us for part 3, where we will be discussing Badger Care expansion, and we will be discussing that with a fellow ER provider, Lieutenant Governor Sarah Rodriguez. As always, take care of yourselves, take care of each other, and if you need me, come and see me.